So if you want to target acceptance in session, you're going to have more power in the exercises and more buy-in if you're able to connect it to why you're doing these acceptance exercises. It's not just about feeling uncomfortable with or lowering your expectations for your quality of your work in Jane's case, but it's about being consistent and supportive, and showing up as the kind of mother that you want to be. Would you be willing to feel this anxiety if that's the entrance fee, to, so to speak, to being the kind of mother that you want to be? You want to target acceptance experientially in session. There's tons of acceptance exercises out there. Some of my favorites is I like to, in the moment, help Jane turn her attention to the emotion that's showing up, or the anxiety that's showing up. And if we're not getting some of that in session naturally, at some point I may have her imagine being back in one of the situations, maybe on her tracking chart, where she did feel anxious, just so she can connect with some of the anxiety in session a little bit, so we can actually practice in real time some of the acceptance or willingness strategies. So then I may ask her to notice where in her body she feels the anxiety, notice the edges. Where is it most intense? What other sensations do you notice in your body? If there was a temperature to it, what would the temperature be? If you could touch it, what would the texture feel like? How big is it? Is there a shape to it? Notice if it moves or if it's still. So all of this is cultivating a willingness to be with that feeling. It's exposure, so to speak. So you can see how this also targets other processes, that there's some present moment awareness in that exercise that I just described. So just as a reminder and as an example, that a lot of these exercises target more than one process at the same time. I may ask Jane to, once she's connected with this sensation, another exercise I like is to then imagine saying no to the sensation, to the feeling. No, it can't be there. Just no. And observe what that feels like. And then shift to say yes to the feeling. Imagine mentally saying yes. Yes, there's room for you. Yes, it can be here. And just notice what that feels like. And it's a really simple exercise that I've had a lot of success with, that can be quick, easy, and pretty powerful in the moment. And then you also have a specific practice that Jane could take out of that session of just mentally saying yes when any given sensation arises, or no. And it could be just helping her build awareness of when she's unwilling to have anxiety, and to just become more mindful of what that feels like. So we're going with flexibility here. And there's a lot more acceptance exercises that you can do, and you'll integrate throughout the entire course of treatment.